My practice is in Austin, Indiana, which is a very small, rural, southern Indiana town. Been there since 2004. Before I went to medical school, I already knew that I wanted to go to a community that had a lot of need. The medical access was limited. In a community that was really wanting to have a doctor to work with. I wasn't really prepared for it, honestly. Austin blew me away when I first opened. Kids that weren't being taken care of, there was no medical access there. Most of them have transportation issues or financial issues. We knew something bad was happening, and I started reaching out for help, the health department and service organizations and churches, and time and time again, people would politely listen, but then they would also politely say there's really not a lot that we can do. And we just didn't have the resources and the ability to intervene before it was too late. And once it hit, it hit.
Dr. Cooke seeks to serve those people in the community that are around him, and when the crisis broke out, he was one of the very first to volunteer to jump in there to see where he could help and assist and what the needs were.
Right after the epidemic occurred, there were a lot of people that did not know where to ask for help and were very hesitant about asking for help. And Dr. Cooke became a leader where they knew they could get help.
Dr. Cooke means a lot to the city of Austin. He, for a long time, has been the only physician in town that was willing to talk to everyone, be a part of the community, and also work very hard to try to make sure the community became healthy.
When you see a family that's been destroyed and kids whose lives have been just run through the mill, and they're basically squatting in homes and selling themselves in order to use drugs, and you see that change into an intact family with a stable house, kids are back home, they're being taken care of, and they have a job. And you're like, yeah, that's what it's all about. And it is beautiful to see that happen in people's lives.
I'm getting ready to celebrate my first sober birthday in 23 years. I'm so excited about that. Dr. Cooke has done wonders for me. He's a doctor that you don't find anymore. Dr. Cooke, he does not just see me as an addict, he sees me as a person. If it takes me 30 minutes to tell him what's going on, he does not rush, he generally cares.
I have this belief that as a physician, one of my jobs is to listen to the story that my patients are telling themselves and telling me, because how they see that story and their role in that story really shapes how their life is going to go.
Not a lot of people would have wanted to come and work in a very small community. Dr. Cooke's presence here as a leader, an expert in the field of HIV and addiction and treating those things is a huge asset for Scott County, Indiana.
To me, the part that's impressive is he doesn't have to do that. He could be doing anything, but he elects to stay here and try to address these issues and these problems.
Part of Austin's story is my story. Give up part of who I am to be a part of a different story, a bigger story. I really felt like it was my obligation to develop the resources right here in Austin to be able to take care of the patients.
Austin without Dr. Cooke would be lost, hopeless, and in a sad shape. He stepped out and led to recovery. We have a great community of recovery now.
I was slowly dying, and now I feel like I'm living, I'm reborn. And without Dr. Cooke, that would not be possible.
He's brought the awareness to the city, and not just to the city, but to the county and the entire state of Indiana, that we can do better.
Anything that we need within the recovery community, anybody knows that we can go to Dr. Cooke and he'll help us somehow, some way. He'll help us.
I have this really firm belief that as a family medicine doctor in a community, it's my obligation to understand the needs of the community and respond to those needs. And I really believe that family medicine is uniquely positioned to be able to do that. I mean, who else takes care of newborns and the elderly and everything in between? It's us.